Ladies and gentlemen, good morning. Welcome to this conference on mHealth. You're most welcome, particular welcome to everybody that's travelled long distances to be here. It's an intercontinental conference. Welcome to the literally millions of people online. And we look forward to the Twitter feed during the conference. First, a few housekeeping points. In the unlikely event there's a fire alarm, don't shout panic, just leave the building and go onto the road outside. Details of the Wi-Fi login are in your conference booklet. For those who do Twitter, the handle is #GetALife. No, that's a joke. It's #UCL mHealth. And before I start, I should say I'm Anthony Costello. I'm the director of the UCL Institute for Global Health. And it's a huge privilege to be hosting this because it started as an idea about 18 months ago when we met with BBC Media Action. And we all started talking about how it would be valuable to have a small workshop of about 50 people. And then 400 applied, so it's got a little bit big. I'd like to start also by thanking people because, in case I forget at the end, I'd like to thank Ed Fottrell, Peter Bias, Sophia Wilkinson from the BBC, Delia, Prue, and the whole of the IGH team that are involved in making this happen, because it's been a very collaborative effort. What else was there? And the other huge welcome, we have two VIPs in the audience. We have His Excellency the Minister of Health from Ethiopia, who we're delighted to welcome. That is Dr. Kasete Birhan Admasu, and he'll be speaking immediately after this. And we're also going to welcome the ambassador, His Excellency Ambassador Berhano from Ethiopia. And Ethiopia has been really a pioneer in hugely developing their health systems, improving quality of care, coverage, and seeing their health indicators come down improve very steeply. So we'll be hearing more about that later. Okay, 30 years ago, just over 30 years ago, when I started as a lecturer at UCL, we had no laptops or PCs. Okay, it didn't exist actually at that time. And we had a mainframe in a room that was cooled down. And then I went to Nepal and I worked in a district, in a remote district, and there was one landline in the entire district. And 20 years ago only, I was first introduced to email here. And I thought, this isn't going anywhere really, we'll stick to fax and letters. And 10 years ago, I got my first mobile phone. I was a late adopter. But nonetheless, it just shows you my career has spanned the most incredible communications revolution. And when I go back to Nepal now, to the same district, everybody virtually, every household has a mobile with more computing power than that mainframe that they had 30 years ago. So it's been an extraordinary transition. And what we're talking about today is how to utilize that power for health gain. And it's not quite as straightforward as we think it is. I should say welcome to London. It's a fantastic city. Unfortunately, although it's got huge numbers of free museums and art galleries, the most exciting city in the world, none of you will actually see that because you're going to be stuck in a conference. And when you go home, they'll say, did you see London? You say, yeah, well, I saw the Kennedy Lecture Theatre, nice blue seats, So we've got a solution to that, which is that you come back and do a longer course with us at UCL Global Health. We run masters, we run short courses, PhD programs. So do come back and we give you some days off to go and sample the free delights of London. And UCL was formed in 1826. It was set up as a radical secular university to challenge the hegemony of Oxford and Cambridge. And it was the first university to take ethnic minorities, the first university to take women, and it has a tradition of being radical and forward-thinking. That's the plug. So mHealth, what is it? Well, we know it has huge value to community systems and potential for education, behavior change, so-called citizen science, and of course in surveillance systems. Huge potential in clinical care through diagnostics, records, checklists, referrals, and we're going to hear a lot about this. Huge potential in the management of health systems, plans, people and training, supplies, delivery of cash incentives. And there are many other things we could talk about. So it has relevance to the whole of, if you like, the health sector and beyond. We know that quality of care is a huge issue for all countries, and we have to think of ways in which we can harness the power of mHealth for systems improvement and also to get evidence into practice, to policy, and to advocate. This is an example of some work we've been doing in Malawi for the last few years. The other issue is, can it change individual behavior? Our experience has been to try and use it alongside relational aspects of care, like women's groups in several countries of the world. But clearly this is an important issue, and it does raise an evidence-based issue, which is the challenge of, is it actually that mobile messages can lead to better outcomes? Is that feasible? Are there regulations about being able to just blindly send messages to people? A lot of growing evidence that sending reminders about appointments is very important, but are people just passive recipients of messages or active participants in health? And how do you link up the informational aspects through mHealth to the relational aspects of care? In the relative chaos of a slum, for example, in this slum in Mumbai, where we do a lot of work, how can we bring some order and reach out to people who are otherwise beyond, if you like, the conventional health system? We'll hear about sensors and the environmental role that mHealth can play in air pollution. There's a project here looking actually at the behavior of children in school playgrounds and seeing whether you can pick up children who are relatively on the autistic spectrum simply by monitoring their behavior as they move around. So modern sensors offer us the chance to monitor environments in different ways. This is a favorite slide of mine because it shows on the x-axis, that is the flat one, isn't it, at the bottom? Yeah. The Human Development Index, and on the y-axis, our ecological footprint. And it really summarizes the problem that for the last 30 years, I and many of you in the audience have been working to try and see if countries with low human development indices will move up. And that's been the view of development. But of course, if we are exceeding our ecological footprint, the problem now is sustainable development. In fact, we're the problem. We in the north, the consuming north, are much more of the problem for development than Ethiopia or others. And they've got to learn from our mistakes, because what we've got to do is go green. And we've got to somehow get down into that quadrant where you have both Human Development Index and sustainability. There's only one country there at the moment. Any offers? It's Cuba. Yeah, who said that? You get a money prize for that. I'll give you 50p. Right. I think Tor Kjellstrom is coming to this conference later. He's done a lot of work using mHealth on monitoring temperatures and the effects of heat stress in different settings, which is going to be a growing issue in many parts of the world, effects on productivity, health, and the like. We know in food security, the relationship between agriculture and child nutrition is of great importance. And certainly in the agricultural sector, the use of mobiles and, if you like, mHealth techniques are extremely important for promoting more conservation approach to agriculture and tracking it through into nutrition. We're all facing an epidemic of getting fat, getting stressed, having our air polluted, having heart attacks, diabetes, and strokes, and all of these have lifestyle, behavioral, community-based dimension, in fact, largely caused by that. How is mHealth going to plug into these new pandemics, and how are we going to make use of them best? And finally, in epidemics, we've just been through, and we still are going through, although it looks as though we're winning in the Ebola epidemic. What role might mHealth have in protecting communities from the effects of those kind of epidemics and snuffing them out much earlier? So I think over the next 2 days, we're going to touch upon evidence, and we must be skeptical as scientists. Many of you are scientists, because mHealth is not a panacea. It is a technical solution which offers huge potential and already is doing great things, but we have to be evaluative in thinking about where it works best, how it works, how much it costs, the value and the impact that different strategies have. We're going to talk about apps, we're going to talk about systems, and I think we're going to talk about going to scale as well. We're going to make it as interactive as possible. In fact, we're going to start this session after His Excellency has spoken with a lengthy panel discussion. Do not be shy. Feel free to chip in with your questions, your comments, your experience, and we'll be keeping a very close eye on the Twitter feed. So if you are sitting at home with a cocktail on a beach and your laptop, and you want to ping in a challenging question to Ed Fottrell, please do. We'll be delighted to receive it. So thank you very much. Was there anything else I've missed? Helen, any other? I think I've covered most of the issues that I was asked to. Right, I'm going to introduce you first now to Peter Bias. Peter is Professor of Global Health at Umeå University in Sweden. We've had a close link with him for many years, and he has done tremendous work in sub-Saharan Africa, and particularly in Ethiopia. And I'm going to ask him to come and introduce our very special guest, the Minister of Health from Ethiopia.